Dr. Margaret Rutherford, and I'm so glad to be back on the Mighty. My first appearance here was back in October when I talked about perfectly hidden depression, and I was so delighted when the Mighty asked me to come back and visit with you bi-monthly about depression. I'm a clinical, just tell you who I am a little bit. I'm a clinical psychologist. I've practiced in Northwest Arkansas for over 20 years, and it is a gorgeous day here in Northwest Arkansas. I hope it is where you are as well. If I could figure out how to record from outside, I would do it. Anyway, I have usually talked about depression on the Mighty, and yet I contacted the editors, a couple of weeks ago and said, you know, what I'd really like to talk about today is anxiety and depression when they're related, when they're all entangled with each other. Certainly as a clinician, I see that all the time. People, in fact, who have significant anxiety are often very depressed about it, or at least moderately depressed about it. So it's not just one thing. Hi, Neris. It's good to see you again. So I wanted to talk a little bit about anxiety. There's lots of diagnoses of anxiety. There's generalized anxiety disorder. There's social anxiety. There's specific phobias. There's PTSD and OCD and of course, social anxiety disorder. All of those can look very, very different, and they have different treatments that work well with them. But we're not going to go really too much into treatment. What I would like to talk about would be, is anxiety a feeling or is it a physiological state? I would love to hear from you. Let's see. Okay, great. Hi, everybody. I'm Dr. Margaret Rutherford. We're talking about anxiety and depression when they're together. And by the way, I've got my windows open, and my neighbors have motorcycles, so I'm not real sure what's going to happen there. But anyway, certainly, as I'm going to repeat myself since some people have joined us, I rarely find pure anxiety as a psychologist treating someone just for anxiety that they don't have depression along with it. So it's which one do you treat first and that kind of thing. We're going to be talking about that today, and I'd like your comments and questions about whether or not when you're having anxiety, if you have panic disorder, or if you have social anxiety, are you depressed about it? Do you also have a recurrent or an ongoing depression with it? I want to tell you I have a very special place in my heart for people with anxiety disorders because I have one. My mother had full-blown obsessive-compulsive disorder. I thought everybody bought 6 things at once and lined them up in their drawers when I was growing up. I had a grandfather with panic disorder, which I didn't discover until I actually found some old newspaper clippings that described in the 1930s style of a panic attack that he would have when he tried to speak. And then I have one of my brothers also has panic disorder, which I'm sure he's delighted that I'm telling everybody on the Mighty that he has. I won't tell you which brother, that way it's a secret. But I developed panic disorder in my late 20s. At the time, I was a nightclub singer and a jingle singer, and I began having panic when I was trying to perform. This obviously was detrimental to my career. And for many months after that, in fact, years after that, I tried to deny it, avoid it, not think about it, didn't want to admit that I had a mental illness, and finally went to a really good therapist who looked at me when I said to him, I want to get rid of my panic, I hate it. He said, well, I'm not going to help you do that. It's time for you to accept it. It's time for you to work with it instead of against it. And that's when I began really learning about how to treat panic. Let me check and see if anybody has commented. I can't see your comments except without these, I assure you. Oh, thanks for sharing. Oh, that's wonderful. I appreciate that. Please feel free again to write comments and questions. I think I can see them here, so I'll answer them if I possibly can. So there's 7 or 8 there's 7 or 8 types of anxiety. And then we talked about just a minute ago before several people joined, so I'll say it. I'd like your thoughts about whether you believe anxiety is a feeling or is it a physiological state. I always thought it was a physiological state. I didn't think anxiety was a feeling, but the more, in fact, I would kind of say, anxiety is your brain on a treadmill or something. But the more I have thought about it, I do think that there is such an emotional component to anxiety that it's also a feeling, and they're just really, really entangled with one another. 25 comments so far, and I can't see the comments. Nope, that's not right. Okay, well, I can't see the comments. Again, thank you for sharing. I don't know why I can't see them. That's odd. Okay, well, we'll just go on. Neris, if you're still watching, I wonder if you could let me know why I'm not seeing the comments. That would be great. Okay, so since anxiety is both a feeling and a physiological state, then it's really important to, when you're working with someone with panic or any kind of anxiety, to help them understand what they can do to try to control it. Gosh, there are 50 comments. Oh, that's really bothering. I'm getting anxiety because I can't see the comments. Wow, this is weird. Okay. What I'll do for sure is when we stop today, I will take some time. I have something else around 2 o'clock Central Standard, but I will take some time and I will answer your comments or address your comments when I get off. I promise you I'll do that. I love to answer your comments, and I'm disappointed I can't see them. This is the first time this has happened. So I'm doing it in a horizontal format, and I wonder if that has something to do with it. Anyway, enough technical stuff. One of the things that I learned in my work with my own panic disorder, and I mentioned it a few minutes ago, is to go toward it. We want to get rid of the panic. We want to get rid of the anxiety. It is so egregious to who we are. It is it can be frightening. It can be, it changed my career because I was having such trouble with it. So one of the things that is hard to wrap around with anxiety is the fact that you want to lean into it. You want to work with it. And we'll talk a little bit in a few minutes about why that's so important. With depression, and when depression is a part of the picture with anxiety, the hard thing is that the point of the treatment of depression is to get you out, to get you engaged, right? To stop this horribly introverted and implosive energy that's coming toward you when you're depressed, and it's so hard to get out of. Anxiety, you're living in the future, you're thinking about and predicting bad things are going to happen. So whereas depression is more living in the past. You're thinking about what you're sad about, or what you're grieving about, what you're angry about, what you're agitated about, and that's in the past. So you've got this strange combination when you've got anxiety and depression about which one. I actually had, there's an old saying, I don't know, it's Arkansas or what, but when you got one foot in the future and the other in the past, you're pissing on today. So I guess when you're trying to treat both anxiety and depression, you're trying to get either one of those problems more present oriented so that you're focusing on what's going on in the present that the person can begin to work with, can begin to understand in a different way. Let's talk just a little bit about the physical pathway that anxiety follows, okay? There's a part of our brains it's a little almond-shaped thing called the amygdala, and the amygdala is the part of our brain that senses threat. It's the part of our brain that woke up as soon as we heard a dinosaur, or we saw somebody in the opposite army running toward us or something. The amygdala goes, whoa, this is dangerous. And so it sends a signal to the hypothalamus, which is a little walnut-sized thing, so sort of nut to nut. And it's a walnut-sized thing in your brain, part of the limbic system, which is where your emotions are. And the amygdala sends a message to the hypothalamus saying, we got to go. The hypothalamus sends a message to the adrenal glands, which are on top of the kidneys on either side. And the adrenal glands start pumping out adrenaline and noradrenaline because it's fight or flight, and we've also added freeze or fold to that, but it's fight or flight. So it's kind of, I don't know how many Trekkies there are out there. I'm definitely a Trekkie, definitely. But if you remember, Captain Kirk would call down to Scotty, we need warp speed, Scotty, and Scotty would go, aye, Captain, and they'd rush off. Well, that's what the adrenal glands are doing. They're the Scotty of your brain, or not, they're not in your brain, they're in your body. And it's the body functioning very well. It's the body doing exactly what it's supposed to do, okay? So the problem is more modern anxiety also has another channel. And that channel is through the cortex, your thinking part of you, okay? The part that makes decisions. Your cortex decides, oh, there's a problem, right? And the cortex then sends the message to the amygdala, hypothalamus, adrenal glands, and the same thing happens. But it's your perception of something that causes the anxiety, not necessarily an actual threat. So that's when there's a problem with anxiety, because there's no stopping it. Once the cortex sends the message to the amygdala, it's a one-way street. And also it's like a car rolling downhill. The neocortex can't stop it once it's going. So that's why it's so important when you've got anxiety to look at what your belief system is. What are you telling yourself about your world, okay? And if you've got a combination of anxiety and depression, then what you're telling yourself about your world is that there are dire things that are about to happen. They're really scary, frightening things that are about to happen. And you've got guilt or shame or trauma or something in your background that tells you that the past is dangerous as well, or the past is painful. And so you've got pain in front of you, you've got pain behind you, and it really can make the treatment of anxiety and depression more complicated. Hello to everyone. The NAMI Moorhead area, wonderful. NAMI's a fantastic organization. Thank you for sharing the video. I appreciate it. And again, I see there are 100 comments. So, you may see me have a panic attack right here. I'll be like Dan Harris on Good Morning America when he had his panic attack several years ago. You'll see me. I'm sitting down though. If I were standing up, you might see me start shaking, but I'm all right now. For those of you just joining, I've revealed that I also have panic disorder, so that's what I'm referring to. And I should say, I guess I'm Dr. Margaret Rutherford. I'm a clinical psychologist in Arkansas in private practice for now 20 years, and we're talking about depression and anxiety. So, as a clinician, what I do when somebody walks in and they say, well, yes, I'm not just depressed about my panic attacks, I'm not just depressed about my OCD, I'm not just depressed about whatever, my generalized anxiety disorder, which is sort of worry and hypervigilance and all that kind of thing. It's also that I have depression from something in my past, or I have low self-esteem, or I struggle with these other things. And again, they coexist frequently. But what do you do as a clinician when that's in front of you? Do you treat the anxiety, or do you treat the depression? And sometimes does one hurt the other one? I'm a psychologist, so I don't prescribe, although I will often refer people for medication if indeed they need it. There are medications that are very helpful for both anxiety and depression, those being the SSRIs, synthetic serotonin reuptake inhibitors. But a lot of people don't want to take medicine, and so exercise can be very helpful for both. But I want to answer my question of myself that I just asked a few minutes ago. Which do you treat first? Well, my clinical decision is usually to treat the anxiety first unless the depression is really severe. I mean, if we have someone who's gotten suicidal or someone who is self-mutilating or someone who has got such hopelessness that they're, obviously we'll go there first. But what I've seen is that sometimes when you help someone with the anxiety, the person will grow more hopeful and the depression will get better as well. So that's not always the case. And of course, anxiety can also be a lot of other things. It can be a masked attention deficit disorder. In fact, I just had someone this week who I believe doesn't really have anxiety disorder. She's just so anxious. Well, purely, she's so anxious because she can't focus. So I'm hoping that once we get her on medication for ADD or ADHD, that she will be much less anxious in her life. So medication can be wonderful for both anxiety and depression. Guess what? Exercise. Exercise can be extremely helpful in both because it just quiets that neocortex that we were talking about a few minutes ago. And, oh gosh, there's so many benefits of exercise. I mean, just using your body in a positive way, in a soothing way, that can be, and especially aerobic exercise, or on the other end of the spectrum, things like yoga. There are many people. I have a yoga instructor as a patient, and she tells me all the time how many people cry at yoga. And I think that's because they're actually releasing emotions that they've had, and that could be actually their depression that is finding a way to express itself. See? I'm back. Okay, sorry about that. You can see I'm at my office. I usually do these at home, but we're doing some remodeling, which is a huge source of anxiety in and of itself. And so I had to do it here. I don't think my connection is quite as good because I'm in the downtown area. But anyway, that's enough about that. But mindfulness is about being in the moment, practicing being in the moment. If you know any of John Kabat-Zinn's work, he's a guy out of Harvard, and he's written wherever you go, there you are, I think, something like that. Full Catastrophe Living is a great text about chronic illness and chronic mental illness as well as physical illness and how to achieve a state of mindfulness with that. It is literally focusing on what's going on around you in the moment. That can obviously be very helpful with anxiety, but can also be helpful with depression when so much of your thinking has to do with the past. Something I'll insert here real quickly is that there are symptoms of anxiety and depression that are kind of shared. Certainly you can have obsessive thinking in depression. You obviously have hopelessness. Your thinking can be very negative and fearful. So those things, and of course anxiety looks like that as well. So it is the mental component of depression that most mimics anxiety or relates to anxiety. Okay, back to what you could do. I like this breathing practice. It's good. People sometimes who are depressed don't breathe. They hold their breath, okay? Some people with anxiety hold their breath. So one of the things that I like is the 5-7-9 exercise, and I will demonstrate the 5-7-9 technique. Okay, so you breathe in through your nose. Through your nose for 5. You hold it for 7, not like a hard hold, but a gentle hold. And then you exhale for 9. So here I go. Ready? Do it with me. If you do that several breaths, in fact, I did it right before I started this video. If you do that before, if you're nervous or agitated, it can really help. The reason why you gently hold your breath is to allow the oxygen flow to get all down in those capillaries and all those little tiny places, blood vessels, so that you're really using your oxygen well. Okay, so there's breathing, there's exercise, visualization is big. If you visualize, wait a minute, I've got some messages here. Oh, thank you. So many of you are sharing the video. Jessica Payne, John Grouchy. John Grouchy. That's an interesting name. Thank you. I do appreciate it very, very much. So visualization literally means that you think about something that you're anxious about, or you think about something that you are sad about, and you visualize, or you're sad that you're anxious about it, and you visualize yourself doing it well. You visualize yourself doing it competently. Of course, one of the ultimate ways of doing this is to go to someone who can do hypnosis. I've done hypnosis, and it's very effective with anxiety. That can do kind of more than a guided imagery with you. It's more, hypnosis is a lot deeper than that as far as relaxation is concerned, but hypnosis is a wonderful treatment for both anxiety and depression. I want to give some ideas also about, again, some common things that are used to treat depression and anxiety. Journaling is huge, and in anxiety, I like to suggest to people that they do what I call a worry journal, where they write everything down for like 10 or 15 minutes nonstop about what they're worried about, and then they close the journal and they don't allow themselves to journal about that or to think about that until the next day. You're trying to sort of fence in the anxiety. Journaling is wonderful with depression as well. A lot of depression is very repetitive thinking, kind of in a rut. And so when you write it down, frequently what happens is that you get tired of writing the same thing over and over again. So it's almost forcing yourself a little bit to go forward with your thinking and try to have some fresh thoughts. Okay, so journaling is really great for both depression and anxiety. Of course, there's therapy. And one of the things, and I didn't talk about this so much, so I'll talk about it now. One of the things that really ties depression and anxiety together are irrational core beliefs about yourself. Things like, I'm not worthy, I'm not valuable, I'm a failure, I'm powerless, I'm not important. Those core beliefs you learned way back when, in your childhood, in a traumatic relationship, wherever you learned it, sadly, and you're carrying them into your life, and they can have significant influence on whether you become anxious or depressed. My particular panic disorder, to share with you, was based on my perfectionism, I think, and I felt like a complete failure. So because I had some life circumstances going on that were very chaotic, and was getting my second divorce, and it was a mess. So my life was a mess, and I had a lot of shame about it. So I think that's what I was genetically prone for anxiety anyway, and I think it just tipped the jar, and anxiety came spilling out. So identifying those core beliefs are so, so important. Thank you Thanks, Greg and Jessica Payne. Thank you so much. Identifying those core beliefs so that you, and the way you can do that is in therapy, I think, is a great way, because a good therapist will confront gently those beliefs and help you see something else. Another wonderful tool, however, is group therapy. Because you are amongst your peers, you're amongst people that they've also shared with you whatever their vulnerabilities are, and when you hear their feedback, it's like you can't say to yourself, "Oh, the therapist just saying that to me because I'm paying her or because she's trying to make me feel better." Generally speaking, when you're in group, you trust more. Well, I hope you trust your therapist, but you can't use some of the avoidance things when you are in group therapy. Sorry. I want to comment too. I can see that there are a lot of comments, and I'm so glad those of you who are watching are watching. I can't see the comments, so I will, this afternoon later, I will get back with you and answer your comments. I appreciate that there's so many there, or at least it looks like there are quite a few. So core beliefs, you could also enter a 12-step program. They are really wonderful. Hi, Rudy. Hi. It's good to see you. I guess I can see if I know people who join. That's wonderful. So when you've got anxiety and depression together, what you can do is work with your therapist, or work within yourself to decide, okay, which one is causing the most havoc. And usually, I mean, as I said before, what I focus on generally, unless the depression is really severe, I will begin to work on the anxiety. Now, a technique that I've also learned within the last 2 years, is EMDR. That's eye movement desensitization and reprocessing therapy. And that is a wonderful therapy for PTSD. I'm sure it's been used for OCD. It's just great for anxiety. I won't go into EMDR, but you might Google it and look it up, and it is a very evidence-based practice as a therapeutic practice. I will tell you, in my own journey with panic, I am much better. I used to be able to, I would sit at a committee meeting, and if someone wanted us to introduce ourselves or something, I could hear my heart racing, and it was terrible. I want to escape. Now, I'm doing this video, for example, without any kind of medication. I do have beta blockers that I take from now and then to help me with my panic. So, but because I have tried to work with panic rather than hate it or want it to go away, I see that as a huge barrier. Reed Wilson has done a lot of work with anxiety, and he always has his patients accept that they have anxiety. And one of the things I like to say to my patients is, acceptance isn't resignation. Acceptance just means you can work with it. It doesn't mean that you just give up and give in to anxiety or depression, but that if you accept it, that then you can work with it. Bipolar, I know there may be people listening who struggle with bipolar. That's huge that you've got to accept it, because you've really got to get good at noticing the triggers. But anyway, that's a whole nother that's a whole nother Facebook Live, isn't it? So let's see. Again, I'm sorry I can't see your comments, but I'm going to go on and stop now. After I give you a little information about me, you can. I do blog weekly, and it's at drmargaretrutherford.com. My email is askdrmargaret@drmargaretrutherford.com, and I will answer you, and it's confidential. I'm the only one who sees it. And I'm delighted to tell you that I've started a podcast, which is called Self-Work with Dr. Margaret Rutherford. You can listen to that on Stitcher, iTunes, whatever. So I'm kind of known for focusing on what you can do about issues, what you can do about mental health, rather than... One time a patient said, I said, well, why did you come to see me? And she said, well, I heard you're not into that unconditional positive regard stuff. So I didn't quite know how to take that, but I thought, okay, well, I guess she wants direct and down and dirty. So I'm not always right, but I'll tell you what I think. So if you'd like to write me, if you'd like to contact me, I'm on Twitter at Dr._Margaret. I love to cook, and all my recipes. I'm back. Sorry, now that's the second time that's happened. But thank you to the Mighty for having me. I'll be back in 2 months, and we'll most likely be talking about either empty nest and depression, because there'll be a lot of people who will have graduated from high school and be getting ready to say goodbye to their college kids. I will admit to you that the day after we took my son to college, I thought I was going to be so great, and I was in his car sobbing, saying, I've changed my mind. Come back. You have to go to the University of Arkansas. I felt kind of silly, so I obviously got out of his car and went in and saw a movie, I think. But that was almost 5 years ago now, so I'm better. But I think it's important to talk about depression and empty nest. So again, thanks to the Mighty. You've gotten all my contact info. I'm Dr. Margaret Rutherford. I'll hope to see you at my podcast, Self-Work, or on my website, drmargaretrutherford.com. Thanks so much. Have a good afternoon. Enjoy the beautiful weather if you can. Bye.